You're gonna start with the foam roller on your back. Okay? So you're gonna lay on your back. And you're gonna lift your leg up, butt up, and place the foam roller directly underneath your pelvis, bony part of your back, so it's not on your spine. And relax your arms on your side. Just first take a moment to sink into the floor, and then let your pelvis open and sink into the foam roller. And keep your feet parallel to each other. Just try to connect into every single body part, your feet, and your legs, and your pelvis, and your shoulders and back. And now slowly you're gonna shift your pelvis side to side. It's very small, and your knees and feet kind of feels like moving a little bit. It's more thing about relaxing your back of your pelvis on the foam roller and just shift side to side. And it should feel good. If it doesn't feel good, maybe you're on your lower back, so make sure you're moving the foam roller much lower than you think. And then just gently sink into the foam roller and shift side to side. Okay, and from here, you're going to take your right leg and place your right leg on top of your left knee. And then just get into this kind of figure 4 position. And make sure your pelvis is not shifting. So the roller is going to guide us, so your hips to your pelvis is level. And now from here, again, you do the same thing. You can hold your pelvic bones, make sure you're not moving up and down. You're just kind of shifting side to side. It feels like you're releasing the back of your pelvis, your sacrum, SI joint area, and upper buttock. And really relax into the floor. And as you feel a bit more comfortable, you can shift a little bit more toward the direction of your top leg, especially you feel your upper buttock. It'll really feel like a little massaging, and then opposite side. And also noticing that you are really relaxing the upper body, so you're rotating from your thoracic bag and then also your pelvis. Nothing on your shoulders. Your shoulders and neck is stable. And then we switch it. So take your opposite leg and then again adjust. Make sure it's your pelvis level. And if the roller slips down or up, usually slips down, so make sure you move it in the right place. And then again, slowly shift side to side. Start slow, shifting. So make sure you're not moving your pelvis up and down. It's just really level. And relaxing the rest of your body. And as you get more comfortable, you can shift a little bit more as you feeling more compression on the upper buttock, like around the sacrum, SI joint area, and then feel a little opening in the lower back and the ribs. And again, nothing on your upper body, shoulders and neck. It's all grounding, just shifting thoracic and lumbar-pelvic area. Okay, from here, we're going to put feet down. Again, if the roller is moved, make sure you adjust. So now you're going to lift your knees up slowly, one at a time, and now relax your knees like toward your chest. And relax your feet toward your thighs. Keep your knees, feet open. And let your back relax into the floor and into the foam roller. Okay? And now you're going to go again, small shifting. Again, very small in control shifting. It feels like you really loosen up the back of your pelvis. This time we are more on the upper sacrum area. And just to help to decompress the spine and loosen up the fascia on the sacrum and the pelvis. There's a big fascia connects our sacrum and pelvis in the lower back. So we're releasing that area slowly. And then hold on the right side. When you hold on the right side, make sure you're not lifting your left shoulder. So just a little bit tilting to the right. And then you can keep your feet together for this one. And then doing a little rotation, circular movements as you're connecting your upper buttock is really sinking into the foam roller. Like again, massaging and releasing that area. Very small movement. Make sure you're not moving your back. And then you go to the other side, doing the same thing again. Right opposite arm is relaxed on the floor, and just tiny shifting and circular movement on the upper side of your buttock. And it should feel good. If you have any pain, doesn't feel good, just move away from this and wait for the next one. Maybe it doesn't work for you. Okay, so you're gonna come back to the center and now drop both feet down on the floor. Okay, and now you're gonna lift the butt off the foam roller and then move the foam roller to the side and that's it. Now stretch the whole body. Try to lengthen the whole spine from your fingers until it's stretch, and let your back arch in ribs stretching. And take a deep breath to the side of the body, big breath. And exhale everything you inhale. Very good. So now slowly return on your hands and knees. And then we grab the foam roller. We use the foam roller to guide us to stretch the back, okay, and the shoulders. So you're gonna come on the knees. Make sure your knees gonna be aligned with the hips, okay, as much as you can. Try not to sit back. And then roll the foam roller as far as you can. And with the, you can touch the palm, not the fingers so much, so you can stretch with the palm. And then try to lift your butt up and really try to get a good stretch through the back of your shoulder and your lower back. And then make an arch on your back. And take a deep breath. And exhale, stretch as far as you can. Again, you're holding the foam roller with the palm and then fingers touching the foam roller. Make sure you're not stressing on the wrist, okay? And then arch the back, extend the spine, relax the neck. Take another deep breath. And exhale. So now you're gonna take your right hand and then left hand on the right side. And then again, guide. You're using the foam roller to roll the arms and try to get a stretch through the side of your ribs. And breathe in and breathe out. And now you're gonna go to the other corner of the foam roller. Again, try to extend on your spine and inhale and exhale. And then slowly come back to the beginning. So now we're going to be rolling on the thighs. We start with the front. So place the foam roller right in front of the knees. And then come on your forearm. And here you need to engage our core muscles. So engage your abs and separate your legs. So make sure you're not collapsing your back. And curl your toes a little bit. And slowly relax into the foam roller with your thighs and roll up and down. Make sure you're thinking about your upper body, not collapsing into the floor. So you're thinking about your core is engaged when you're rolling on the thighs. And you're going just slow and find a tight spot on your thighs. And maybe hold it there. And just move it a little bit up and down. Really try to relax your thighs on the foam roller. If they are too tight, it's easy to kind of go tighten up more or push against it. Make sure you try to really relax into it. Okay, from here, you're gonna hold it and you're gonna try to bend one knee at a time slowly. So this is gonna feel a little bit more intense if you have really tight quads. Or you have a little problem with your knees, so it also works. You're working on the knee, stabilizing the knee joint with this movement, so make sure you're going very slow as you extend your knee back down to the floor, controlling the movement. Very slow, very good. And engage your abs, try not to collapse to the floor. And then you can move down or up wherever you feel more tight and needs more attention. And then you keep going with the same slow movement with your knee. And try to flex your foot a little bit. Very controlled on the way down. Very good. And then from here, slowly roll down and then drop your knees down. So now you're going to be rolling on the inner thighs. So you're going to lay on your side and place the foam roller directly underneath your inner thighs. And then come to your stomach. So that way, the foam roller right in the middle of your thighs. And you're just going to shift slowly your hips as you roll underneath your thighs and toward the groin. So if you want to go a little bit more to your upper thighs and groin area, you want to kind of turn your body diagonal to the opposite direction and really relax your leg and always try to relax into the foam roller, the whole body. So that the whole experience for you, the muscles and myofascia, fascia, all the tissue will let go. You're not pushing against it. You just let go. And then you can move a little bit more down on the knees. So if you move your body farther. So now you're just above the knee. If you have a little bit of knee tension, or this will feel good. And again, really relaxing your foot on the floor. And if it's too much, move a little bit in different place and then come back here again. It's all connected. You release one side and then you go down again. It feels much better. Okay, and then from here, we're going to go to the other side. So you can compare your sides if it's different. Lay down the side, the foam roller toward your belly, so there's space to roll. And come on your forearms. And then slowly going side to side right in the middle. And then moving up toward the groin area, turning your body diagonal away from the foam roller. Again, this area might be sensitive. Try to really relax your foot and breathe in. And as you exhale, let go, relax into the tension. And now moving away a little bit, so you can move it to the inner side of the knees. Again, it's great for your knee tension, knee pain. And slowly again, rolling, relaxing the foot. Okay, and then from here, we're going to be doing the buttock. Everybody's favorite. We're going to sit on the foam roller. Be careful, don't fall back. So right in the middle. Okay, and your feet on the floor. And you take your arm behind. Make sure don't shrug. And then lean to the same direction. And you're going to be on the upper and middle side of your buttock. And then shift your body up and down first. So you kind of search where you have more tension. And then you can also rock side to side. Just kind of travel around, but always slowly. So then you can feel any area of needs some attention and you need to release it. And then if you like, you can take your bottom leg and cross. And it's going to be a little bit more intense. And you can do the same thing, the muscles a little bit stretched. So it might be a little bit more intense. So just you're in charge of finding the right compression, right? So it feels you need more compression, go for it. You don't need more, just back up or put your foot down. And then little circles up and down, maybe hold it a little bit. And just a small shifting back and forth. And then you do the other side. Again, little turn to the side. You can rotate the leg. Again, this is too much, you don't have to. And the opposite arm, the arm is not sharp. So your arm is a little bit controlling your pressure as well. So if you get a little bit more higher, will be a little bit less. You sink more to the back and the side. And that's the releasing the buttock and upper buttock area for any tension on the lower back. Also, this helps to release the butt. Okay, so now we're gonna work and challenge our balance in a little bit of core stability. So you're gonna place the foam roller just like this, and then sit on the end. Okay. Be careful. Always you can watch first if you need to. Okay. Open your feet a little bit wider. And then slowly roll down on the foam roller right in the middle. So make sure your spine on the foam roller, so you're not on the right order. Okay, you're right on the center. And just again, relax into the foam roller. And you might feel a little bit maybe dizzy at the beginning, because this is moving and you're trying to balance, and your arms on the floor with your palms facing down. So first, just see you can center yourself and stabilize. Once you're stable, open your arms a little bit wider and then just shift side to side. When you're shifting, try to stay connected to the foam roller, so your body is not really moving. You're really like a stick into the foam roller, and you're just shifting the whole body together. So you're not really moving your foot or your neck. So your spine is very stable on the roller, and just you're shifting with the momentum. And your goal not to fall and not to shift your hips and back and neck and feet. Makes sense, right? Okay. So the goal here again, balancing and stabilizing yourself, being aware of where you're in space, proprioception. And you're really connecting into your body. Okay, so now you're good with this, right? So now relax your arms again on the floor, a little bit more closer to the foam roller. So now we're gonna try to lift your legs up one at a time first, okay? And take a deep breath. And when you exhale, lift your right leg up as high as you can. Your knees stay 90-degree bend. And then lower down slowly. And then inhale and exhale, lift the other leg. And then you're bracing your abdominal muscles as you lift, and try to be as stable as you can. Again, the goal, keep the foam roller stable underneath your back. And you're being aware of your core muscles, your abs and your back. And also your hip muscles. And the breathing. So you're exhaling as you lift, controlling the pressure. And on the down way, you go inhale slowly. All right, we do one more time. Exhale up. And inhale slowly. Really controlling the movement. Exhale up. All feeling in your abs as you lift, and inhale down. Perfect. Now we're gonna try to do opposite arm, opposite leg. Are you with me? You can do it, right? Okay, bring the arms a bit closer to the foam roller, okay? Okay, ready? So concentrate. Doesn't matter which side you want to start. Inhale, exhale, and you go opposite arm, opposite leg. Breathe in first. And exhale, lift, opposite arm, opposite leg. Arm is going straight back behind you. If you can touch the floor, it's good. Don't force. And everything going down slowly on the inhale. And again, your goal not to shift, okay? And exhale up. You'll have to concentrate. And inhale, slowly down. Really tuning into your body, whole system, all the body parts. And focus on your opposite foot stable and not grabbing the floor. Focus on your neck is stable. Focus on your jaw and your eyes are relaxed. And inhale, very slow in control. Perfect. Let's challenge a little bit more because you're doing great. So again, hands on the floor. So now I'm gonna try to lift both legs, okay? Not the arms, okay? You're gonna lift your right leg up first, so you can connect. First, see you're stable, okay? Don't rush. You'll have to wait and concentrate. Before even you lift your opposite foot, you have to visualize that you're actually lifting it, okay? Ready? And on the exhale, lift your other leg up and try to hold the tabletop. So your shin parallel to the floor, your knees and hips align, and try to not to press hard with your hands. Try to keep your hands a little bit more lighter, rather concentrate on your core, and make sure your neck is straight, not arched back. So you're looking directly toward your knees or to the ceiling, but not arching your neck back. All right, now concentrating your breathing into your nose and exhale out your mouth. And the goal again, try to be as center as you can and as stable as you can. You did it, perfect. Another challenge here. You can alternate your legs, so inhale. On the exhale, lower one foot as low as you can toward the floor. And then inhale, lift. And then exhale, lower the other leg. Make sure your back is not arching. Really concentrate using your abs. Or you're lowering your leg as much as you can. You can modify just to lower your leg a little bit. And then inhale. And exhale, other leg. And inhale. And advance, lower forward without extending, overarching the back. Again, you're feeling the abs working. And relax your jaw and face. And your hands relax. Very good. One more time. Inhale. And exhale. Inhale. And exhale. Perfect. And then drop the feet down. And just slowly roll yourself down on the floor. Drop yourself and you're on the floor. Perfect. Now I'm going to finish the class rolling underneath the middle back and mobilize the thoracic back. So roll up slowly, place the palm roller right underneath the base of your shoulder blade. And take your hands behind the head, your elbows slightly forward, not overly extended back or not close, so it's kind of diagonal. And your fingers in your legs nicely placing behind the head. And we're going to go into flexion with the spine. So you're a little flexed here, not extended. So you're using your abs to hold this position. And you're just going to slowly shift the body side to side from the waist, not from your hips. So your hips, lower back is stable, your feet are stable, your jaw's mobilizing your thoracic back. And your neck also stable. And inhale and exhale. Concentrate into your breathing, how you move, and feeling like releasing some tension in the middle back. I'm sure everybody has some crunchiness on the back. soft tissue crunchiness, I'm not talking about the bones. We all have that because of the stiffness in our tissue over time accumulates from moving too much, not moving enough, or just getting older. All right, perfect. We then go to the side now, and then you turn directly to your side and stack your knees together. See, now the foam roller right underneath your kind of armpit and on the side of the shoulder blades. It might be a little, it's so tight there. And you're gonna rotate your waist side to side. And here again, the goal not to move your knees and the hip and the lower back. It's really moving from your thoracic back and not the shoulders either. You might feel a little movement on the shoulder, but it's all coming from your waist. And your neck just follows. And you're rocking slowly back and forth as you're feeling a little compression on the side of your ribs and side of the shoulder blades. Really tender spots there, lots of connection in that area, especially have a little bit of shoulder problems in the back or currently. And going slow, inhale and exhale. Enjoying that nice stretch. And just one more. If you could hold that stretch, rotation, and lightly sinking into the foam roller, try to open the ribs, open the chest, and your neck is really staying relaxed on your hands. Try to keep your chin a little bit more down, and try to get the extension and twist from your ribs and the middle back area. And take a deep breath. And exhale out your mouth. And slowly come back to the beginning. So now stay here. You're going to stretch the arms overhead and try to really let go your body on the roller. And relax your neck and face in the jaw. And breathe to the side ribs. Expand right here on the side. And exhale down. One more time. Inhale. You can even put your hand on the side of the ribs, is going up toward the ceiling. And the back of the ribs. And exhale. And the ribs going in. All right, so now slowly push up. You're going to the other side. So again, knees together, 90 degrees. Put the foam roller right underneath them. Shoulder blade on the side, armpit, and stuck the interlace the fingers, hands behind the head, and we're gonna start slowly rotating back in the front without moving your lower back. It's very tempting to go farther, and then you can see how your back is gonna start doing the work. It's normal that we don't have a lot of rotation on the middle back. And that's why we were trying to practice here. So don't force. And always, you should feel good. A little uncomfortable, but always feels good. And keep going with the breath. Inhale. And exhale. One more time. Inhale. And exhale. And try to hold the position. And again, no forcing, just sinking into the foam roller with the back of your shoulder. Keep pressing your knees together. And breathe into the side and back of your ribs. And exhale. Inhale. And exhale. And coming back to the beginning and stretching the arms. Try to lengthen the whole side of the ribs open. Relax your face and neck on your arm. and practice the side breathing. Breathe in, expand the ribs to the side and the back. And exhale, as the ribs are going all down and in. And again, inhale. And exhale. Pulling the abs and down here in the pelvic floor and all deep muscles engaging. And again, inhale. Side ribs, diaphragm, back of the diaphragm. And exhale, everything you inhale, nothing leaves in the body. Very good. And slowly push with your arms. And you're gonna go seated position. We're gonna open both legs today. Try to lengthen the thighs using your upper thighs, your quads, to keep your knees straight. And we're gonna use the foam roller to guide us to stretch, okay? Open the arms as wide as the foam roller and take a deep breath. And then just relax down toward the floor with your spine flexed. Not extended, you're just kind of relax the back and keeping the back of your hips and sacrum open and breathe. And every exhalation, you're trying to let go and stretch a little farther without forcing. And inhale and exhale. And just a little bit more. Keep pressing your thighs into the floor and keep your toes up. And again, inhale and exhale. Really relax into the floor. Relax your neck and face and jaw especially, and upper part of your shoulders. And just feeling a little uncomfortable around the thighs, inner thighs and back of your thighs, and a little bit your calves as well. And last one, inhale. And exhale, deepen the stretch, helping with your breath. And relax. And slowly roll back. You can use the foam roller to guide you to roll up. Very good. So now we're going to do the opposite. So we're going to bring the feet together and come into the butterfly position. Okay. And you take the foam roller back. And it's okay, you can go all the way down with your thighs, don't force it, and just be more upright, okay? Be more upright in the only area you're squeezing your toes together, but not curling, okay? And then again, hold the side, each side of the foam roller. Try not to go back, just be upright. So your shoulders above the hip and then press the feet together. This is a bit intense and uncomfortable. And roll your shoulders back. It's really lengthen your spine and work your middle back muscles. That's why it's hard, because you're always leaning forward. And try to hold this position. Just push the foam roller on as far as you can, but without leaning back, okay? And really think about squeezing your shoulder blades a little down and together and press your feet together. And take a deep breath to the side and exhale. And try again. Inhale. And exhale. Very good. And that's it. And you're going to hold the foam roller on one side, cross your legs normally, and stretching the side all the way up, and then rotate a little bit. Again, guide, use the foam roller to guide a little bit and push a little, and keep pressing your opposite thigh into the floor. Relax the bottom shoulder, try not to shrug it. And another deep breath. And exhale. And then last stretch on the other side, of course, right? Again, use the foam roller to stretch. First a little bit side and rotate. Keep pressing your opposite thigh into the floor. Inhale. And exhale. And grab the foam roller, stretch all the way up. You don't see mine so much. And now you can extend back. And exhale, you did it. Thank you so much.